Hi, my name is Natasha Halasa. I'm a professor in pediatric infectious diseases at Vanderbilt University Medical Center. Thinking about that, one thing we were surprised, we actually thought there would be an increase in antiviral use during the COVID pandemic because we actually saw that not only were people testing more frequently because they're getting in the habit of testing for SARS-CoV-2 to see if they had COVID-19 disease. And so we actually were a little surprised that it went down. So part of that, they may be doing more testing, but issue may be they may not be getting the results back in time for them to make a decision. Also the perception that if they've been in there greater than 48 hours, that it quote unquote may not work. That is a question what we're really trying to understand of the barriers behind that. As I said, with inpatient, the perception may be if they've been in there longer that the antiviral use may not work. Anecdotally, we've actually seen some parents that refuse to take an antiviral despite doctors wanting to prescribe it. And also just making clinicians more aware of the recommendations that even if they've been in there longer, even if they're not high risk, the fact that they're hospitalized with influenza, the recommendations by both the Infectious Disease Society of America as well as the American Academy of Pediatrics is to treat even regardless of testing. So one of the things that I believe is happening is ICU doctors are actually seeing the complications associated with influenza. And so when they start to see the cases and with reports that are out there that it could reduce complications, I think they're more likely to want to start an antiviral because I feel like that's something that they can actually do. They can obviously do the supportive care, but when it comes to a medication, being more aware that they can actually use the antiviral that it work. I think when they're not in the ICU and they don't have an underlying medical condition, some perception by some hospitals may feel that it may not have direct benefit. So when it comes to hospitalization, I think the timing needs to go away and that the recommendations from the American Academy of Pediatrics as well as Infectious Disease Society is that antiviral treatment as soon as possible, even if they've had symptoms longer, has been shown to be beneficial, especially in those with an underlying medical condition. They're less likely to have been admitted to the ICU. There's a nice study that showed that in solid organ transplant patients. But the key is, regardless of the symptoms, the goal would be to start the antiviral use as soon as possible when they're hospitalized. An example of what we've done to improve this at Vanderbilt was through a hospital medicine fellow that basically when there was someone who was hospitalized and they had a test that was positive for influenza, the orders for an antiviral treatment actually just popped up right away. So you had to actively decline it. And so it's a good reminder for the clinicians that are and the residents and hospital medicine that are admitting the patients as well if they're in the ICU that acknowledging that there was a flu positive test and that antiviral treatment can be initiated. Also working with your antimicrobial stewardship program, even though it's for antibiotics, they're also the ones who could potentially notify the groups that flu has been detected and then an antiviral would be beneficial.